Hi, I'm Sarah Lindsey. I was the moderator of a session this morning called Orphan and Novel Receptors, and I'm pleased to have with me one of the presenters from today that was selected from the abstracts for that session. Can you introduce yourselves?
Yeah, sure. Thank you for the invitation. My name is Rafael. I'm postdoc in University of Pittsburgh in the Bruder's lab.
My name is Thiago Bruder. I'm assistant professor at University of Pittsburgh, and I'm glad to have Rafael as a postdoc in my lab.
Awesome. Great job today on your talk. Would you mind giving us a little summary of what you presented earlier?
Yeah, sure. We study high levels of aldosterone, and we discovered that the high levels of aldosterone induce endothelial dysfunction, renal damage, and hypertension. The mechanism that justifies this effect is associated with the CCL5 via CCR5. When we use it, the CCR5 knockout mice, all these effects, the effects was protected.
And so do you know that the effects of aldosterone were through the mineralocorticoid receptor?
Yes, when we block the mineralocorticoid receptor with eplerenone, a specific antagonist to mineralocorticoid receptor, we don't have more this upregulation of the CCL5 and CCR5, for example.
Dr. Bruder, can you tell us more about CCR5 and the clinical implications of your study?
Sure. CCR5 is a chemokine receptor, and basically it's responsible to recruit immune cells into the inflamed area. It has different ligands, and the main one is the CCL5, or also called RANT. Although CCL3 and CCL4 are other ligands for the CCR5. But people usually focus on this receptor in infection disease, and not too much in cardiovascular disease, as we have done in the lab. And I think CCR5 is clinically relevant. The reason for that is because there is a very specific antagonist, a blocker for this receptor. It's called maraviroc, and it's available to treat HIV patients because it helps to reduce the viral load. And in addition to that, there is a certain population which has a mutation in the gene for CCR5, but we still don't know if this population might be protected from cardiovascular disease, or in your case, if aldosterone does not generate a hypertension or injury in the cardiovascular system for those patients.
Thank you so much, and congratulations again on a great job on your talk this morning. Thank you.
Thank you.
Thank you for the invitation.